Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics. I'm Stephanie Taleo with Practical Dermatology magazine. Patient age correlates with response to immunotherapy in melanoma, and depleting regulatory T cells in young patients may have a therapeutic potential to enhance response in younger patients, according to research from the Wistar Institute. Study results were published online in Clinical Cancer Research. Not all patients benefit from immune checkpoint blockade therapy, and some responders eventually develop resistance, highlighting the need for biomarkers that could help predict patient benefit and guide therapeutic choices. We have shown that the characteristics of the aged tumor microenvironment in older patients promote resistance to melanoma-targeted therapies, highlighting the importance of considering patient age when predicting response to therapy, says Dr. Ashani Weeraranta, the corresponding author. Based on this consideration, the researchers set to analyze the impact of age on response to immunotherapy. We were initially surprised to find that older patients fare better on immune checkpoint blockade therapy, she adds. The researchers analyzed a multinational, multi-institutional cohort of almost 500 melanoma patients treated with pembrolizumab, an anti-programmed cell death receptor 1, PD-1 checkpoint therapy. They observed a significant difference in response to treatment by age, specifically that older patients had a decreased chance of disease progression after therapy, irrespective of gender and prior treatment with targeted therapies. This observation was confirmed in mouse models of melanoma. In fact, genetically identical tumors responded more to anti-PD-1 treatment when transplanted in old mice than in young mice, suggesting that the difference is ascribable to the environment in which the tumor develops. The researchers analyzed the immune cell composition of the old and young tumor microenvironment, both in patient-derived tissues and in mouse models, and found a significant decrease in tumor infiltration of regulatory T cells with age. These cells, characterized by expression of the OXP3 marker, suppress the anti-tumor immune response and reduce response to anti-cancer immunotherapy. In parallel with the decrease in the percentage of Treg cells, older age correlated with increased presence of killer CD8 T cells, which are the primary effectors in the response to immune checkpoint blockade therapy. Based on these observations, the researchers depleted Treg cells in the young mouse model by targeting them with an antibody against CD25, which is predominantly expressed at high levels on the Treg cells. Combining anti-PD-1 and anti-CD25 treatment was significantly more effective than anti-PD-1 alone, and they obtained response rates to those seen in aged mice, suggesting that overcoming the immune suppression observed in young microenvironment helps to restore sensitivity to immunotherapy. Our study shows that age is an important factor to consider when administering immunotherapy to melanoma patients, adds Dr. Weeraranta. A combination approach to deplete immunosuppressive cells in combination with checkpoint blockade therapy might benefit younger patients, although further studies will be required to evaluate more broadly the potential immune toxicities of this approach. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Ortho Dermatologics.